Dear audience, welcome to the show POWERchat. In today's episode, we are discussing about tackling COVID-19 in Nepal, the global pandemic. Joining us today is Dr. Praveen Mishra, former Health Secretary of Nepal. Please allow me to welcome him. Welcome to the show, Dr. Mishra.
Thank you and good morning.
How have you been?
Yeah, fine. Thank you.
Well, this is the 6th day of the national lockdown in Nepal, and there is a 5th positive case of the COVID-19 found in Nepal. How are you observing the overall situation of COVID-19, especially the ways tackling this pandemic?
Looking at our situation, I think still we are not so bad. Still we are in the stage 2. Internationally, if you see globally, the situation is really worse. In comparison to that, in Nepal, I think still we are in a better situation. Let us hope should not enter into the stage 3, which is really going to be suicidal for us. It will be unimaginable that how we are going to tackle it down. But the government so far, the very first step that has been taken, which is supposed to be taken for the welfare of the people, lockdown, is good enough. And I really appreciate the people who are abiding by the government's decision, and nobody you will see on the road. This is going to help a lot to break the chain and to bring out this very outbreak immediately. So I think this is a very good sign, and in the time to come, as we can see in the Italy, France, Spain, Germany, UK and America, they had done the same mistake initially, which we really corrected on time, and the government has implemented, and we are abiding by that. The people are abiding by that.
Well, Dr. Mishra, are you of the opinion that government's initiatives and efforts are in line and we are in a way to control it?
Well, the very first step that's supposed to be taken, I think the government has taken. But the real examination starts now, when we are going to enter from stage 2 to stage 3. Means from a sporadic to the cluster, to the community. If we don't enter, means the government step that was taken initially of lockdown and closing down the airports and all those activities, I think that will prove to be fruitful. But this week is very important for us, that we should see whether we are going to enter in the next phase or not, next stage or not. And then the real government's preparation or the government's preparedness, people will be able to see. Because we will be now in a situation when if it enters, it will be exponential increase. It will be in the geometrical progression, not in the arithmetic progression. It will be difficult for us to combat it, to contain it. In that case, whether the government preparation relating to its identification, to isolation, testing, treatment and tracing, these 4 or 5 things is in place or not, that we will be able to decide, we will be able to see, and that's where now the government should be able to really prepare themselves for it.
From the beginning, you focusing on the government, initiatives and efforts and all. You served with the ministry as the secretary. How are you observing the coordination and actions taken by the Ministry of Health and Population here in Nepal?
Very frankly, when you say, I think there is a slightly delay in the preparedness. When in the month of December, the virus in Wuhan, when they started, we could have started our preparation at least from January. Because for the technical support, we have our WHO country office here. For all these things, they are over here. To support us in this situation, we could have taken support from them. And We have a very good epidemiology division where everything was in place when I was there. We just needed to sensitize them, initiate them, and that would have come from the leadership. Now the leadership, it depends that in a situation like this, how rapidly, how fastly, how judiciously, how visionarily you are going to implement or you are going to start your preparation. If the leadership is not visionary, then it will be difficult.
What should have been done by that time, and what should the government, especially the Ministry of Health and Population, do now?
See, the National Coordination Committee which formed, I think it should have been formed quite in the month of earlier, quite in the month of, say, at the last of
December?
January at least, or first week of February. But it was quite late, number one. So the National Coordination Committee, when it outlaid its action plan or its policy, that needs to be taken down through the health, I think through the principal secretary down, and the work should have been started. Now yesterday the flight went to China to get the logistic support for this problem what we have. I think this should have gone in the month of January itself, because the personal protection equipment which is in the for the front line of the health workers is needed at any time, and at least it should have been in the, I think in the month of it should be in the with the at least minimum of 50,000 number should be available all the time with the epidemiology division or through the logistic division, wherever it is, it should have been available. And that was the responsibility of the leadership to see that whether all these things, because the very front line, the health workers are there, if they don't go or if they are in a situation of a stress, they will not be able to work in this ward level, at ward level in this situation.
Are you saying that they are not safe and the necessary arrangements have not been made to protect the frontliners, the health professionals?
Yes.
What needs to be done?
That should have been done long back. Now today I heard the flight is coming with all these personal protection equipments, and at least what I say, not necessarily everything has to be depend on the international community or some other. We could have made our own. When it started in December, from January, February, March, we had 3 months. We could have invited some of the people and who is responsible for all this stitching. Can you make with this, because we have a WHO country office here. They would have given us the specification. With this specification, we could have made easily, very cheap, at a very cheap cost, readily available to the nations, to the people, to the health worker, and on time. So that is what I feel. If I would have been still in place, I would have done the same thing, rather than waiting from some other country to come after 3 months, and the people are in panic and paying more cost also. And because this money we could spend for the people.
Well, also the provinces and the local level, government bodies seem to be confused, and the people coming from abroad are not appropriately quarantined. Even if they are quarantined, the places and the hygiene and sanitation and everything, it looks so critical. So how can the quarantine kind of thing, the isolation kind of thing, be made more accessible to the people who want to go into quarantine or into self-isolation? There is lockdown, but lockdown alone does not guarantee the safety of someone who suspects himself or herself. What you have to say on that?
See, when you start, very rightly thing you have put forward, like the federal context we have. In this federal context, the central government, the state government and the local government, 3 tier we have. This is a very good opportunity to prove for all the head of the states that the federal system is really good for Nepal, or they are capable or incapable. They can implement or they cannot implement. They can work hard or they cannot work hard. What I mean to say, this is an excellent opportunity to prove for the political people also, to the national and the international community also, that the federal governance of Nepal with the 3-tier of system is really very good, because it has been proved in a situation of disaster, in a situation of an emergency, in a situation of where everybody is panic, and they have. So number one, to do this, to tackle this situation very efficiently, effectively, the central government should be able to lay down all the protocols, and with that protocols, the state government should start its implementation, and to see that the life of the people is safe, and they are really doing a lot for the people at this stage of pandemic. Likewise, the local governance should be able to prove themselves, because a lot of power has been given to them, lot of financial resources are with them. So that time, if at all, so these 3 things is going to make us prove also in the future that whether the federal context is really good for Nepal or not. And the central government, Ministry of Health and Population, whether they are capable of monitoring and regulating the state government, and so this is going to give us a good opportunity to have a good learning, and how to make the learning from this situation in the future also. So this is going to be a really good opportunity for us.
Well, there is also criticism about the government's performance, especially that there are some technical things that needs to be done. Also, there are some medical requirements within the ministry and its operation within the committees and all. And the criticism is that ministry is not appropriately coordinating these all things, because there is no secretary at the ministry coming from the health service background and all. And WHO at the time has urged all people here in Nepal and elsewhere to protect themselves by testing it. 3 requirements: test, test, and test. Do you think that someone wants to test it, and the test services and resources are easily available?
See,
so far there are only 900 tests, 5 positive. What should be the scale of test?
See, now the two things you have asked me in this question. One, the technicality of the ministry. Second, the test part. Regarding technicality, I will say, yes, the efficiency of the ministry doesn't seem to be at it's supposed to be in this. And the reason you have partly said already. The person who is at the highest level of the bureaucracy, which is the secretary, he is not from the medical background. So he doesn't know much about it. But at the same time, as you said, they should not try to poke their nose everywhere where that is not their cup of tea.
But there are people who could support him.
Yes, exactly.
Their expertise has not been utilized.
Yes. Now, the people are there at the same level of high expertise, high quality of expertise, like the chief specialist. 4 chief specialists are there in the ministry. The leadership should be left to them. Now, one line, I need to prevent this. I don't want any lacking. So for that, everything coordination has to be done by the secretary. Minister says, no morbidity, no morbidity, no mortality, no morbidity. So that's what the policy makers supposed to trickle down like that. Secretary should not be a doctor. I mean, he should not go and start, because I am a health secretary, I should not go to the hospital and start checking the patient. No. That is not the protocol, and that should not be there. Yes, secretary is there to coordinate all the ministries from top to bottom and see that how the things are. Because everybody is a chief of one division, but above all is the health secretary. So this way, I think the technicality has to be corrected. Now, second part you said of the same question is how do you take about the testing that WHO is still saying. See, now we are crossing, we are in the stage 2. When we identify, isolate, right, test, and in the test, as you said, 3 only, there is no way out. So now people have already avoided by the government in a very excellent way. Now it's the part of the government now to show its efficacy and its generosity by testing the people. So you can ask, shall the government test all the 300 lakhs people, 3 crore people? No. There is a protocol for it. The specialists,
what is the protocol?
I will tell you. The specialists are there who, suppose 1 minute, I will give you a scenario. I checked 100 people in this room, right? Nobody is positive. No need to go for another room to check the 100 people. So there is a random checking also. There are different methods of cohort, methods of finding out the disease pattern in the epidemiology, in the public health. For that, our experts are there, they will do it. Now they go randomly, they check out of 100, 10 people or 15 people. Random, from different sources. One coming from abroad, one is professionals, another is coming through the airport, another is crossing the, or somebody has travelled from abroad. Likewise, random mechanism is there. So the specialists are there, they decide. I can't tell you about all these details. Third thing, that once they find out that the random sampling also showing that it is not a pandemic situation, still we have not not entered into the outbreak, then we should be but there is a chances that the outbreak is there. We should start our preparation for the readiness for the, if outbreak happens. If it doesn't happen, well and good. God saved us. Government, we followed. We saved ourselves. Government saved us. Now, if the outbreaks happen, we don't know. Because we don't have a very surveillance mechanism here. We have not been able to go to house and find out the cases. Actually,
but Dr. Mishra, there are some specific cases that some people coming to Nepal after March 15 through some airlines from Qatar and all, and there is question. The criticism is that the people landed here after March 15 have not been appropriately sussed out. They are roaming around. They have joined families. They have joined rituals. They have joined celebrations and all. That is the case. How can those people be found out
now
and tested?
Yes, you are very right. Now, I had seen one in Facebook, all the name and the address of those people. I think government has asked them to go on into quarantine, and the general, because the names are already displayed over there. I'll tell you, one person among them, they also contacted me. They had travelled from USA or somewhere via Qatar, and he told, well, I'm fine, still fine, because it was more than 15 days. So I'm fine, I don't have any problem. Shall I go to the Teku? If you don't have any problem, you just check with your local doctors. If he says no problem, and 14 days you are fine, no fever, no nothing. And if you are not, but they themselves are, some of them are keeping themselves in quarantine also, so that they should not spread to the family members. Now, we are not aware of some people who has really infected. The government is the government duty, security, that's where the security comes. The security will track them, find them, and isolate them. And the contacts, they will also discover the contacts. So far, how many people he was in contact, and all of them should be put in the quarantine. Now, if we could do this, and then if anyone becomes infected, we should treat them and trace them after treatment. So I think this is the way we should be. It should be working. I think still, if we have some of the information about the passengers coming from abroad, especially from the European countries or the Middle East or the China or Hong Kong or somewhere else, I think we should be able to track them out and inform the local. If they have gone to the local place, they should be informed to the local governance also and state government also that these are the person who are gone there. Please see them and keep it under observation. We have a mechanism. You remember our polio Abhiyan, where we are going every home to home. Why not in this? The same mechanism can. 2009, I was health secretary. I remember we have H1N1 and there was a big panic and we had managed it. We have a basis for it. Ministry has the base already laid down. They had just to modify something to start the work for the.
But Dr. Mishra, by that time, it was not a global pandemic, so international support and resources are also coming. How do you analyze the situation at a time when something is a global pandemic and all countries are suffering this same thing? And how can we utilize our own resources? Very quickly, we are coming to the end of the show.
See, I think that time also WHO has declared it pandemic, H1N1. Now, global situation was there, but the death was also there, but very little. Infection was more, death was little. Here, infections are very much, death is also very much. Here, most of the donor agencies or the donor countries, they are engaged with them they are on their own place. They are engaged on their own people's victimization that they are under corona.
What do you have to say about the WHO's role in Nepal?
WHO is basically, if you see, is a technical agency who is going to help us technically. But if you see, people are criticizing the WHO for their role, initial role, and how they have changed their stand. If you remember, I think 31st January, they have declared the public health emergency. It was quite late. It should have been a bit early, what I feel personally. Maybe in the first week of January.
What is the way out, very quickly, tackling this COVID-19 in Nepal?
See, the very first way out is, I think, what we have done, distancing and all these lockdown. Second is finding the maximum number of cases by testing. If it is needed, treatment. Testing. If it is needed, testing. And testing is what you said is very important. At the reservoir level, we should start the testing, then treatment. And after giving the treatment, we need to trace them also, whether it is the reinfection is going or not, and we should track them also. So these are the 5 things that if we can do it, I think we could do it.
Well, Dr. Mishra, it was a pleasure talking to you. Thank you very much for joining us.
Thank you.
Dear audience, time now to wrap up the show. Keep watching us. See you next week. Namaste.